Well, good afternoon, everybody. And thank you very much for your ongoing patience throughout this long and nonetheless inspiring day. My name is Dr. Damien Riley. I'm the Medical Director of East Lancashire Hospitals Trust. And I'm joined here on the platform by Gary, Chief Executive of Blackpool Hospitals Trust, by Faluku, the Director of Ops and Strategy from University Hospitals Morecambe Bay, and Karen, the Chief Exec of Lancashire Teaching Hospitals. And we are the Lancashire Group of Hospitals. And our mantra is quite simple. It's putting patients before the organisations. And a lot of what you're going to hear from me and from Gary following me in a moment will be stuff you've already just heard. But I think there's reason for that, which will become obvious as we go on. Now, for those of you who don't know Lancashire well, we're 1.6 million population over a geographical area of 3,000 square kilometres. We're larger than some of the smaller European countries. We occupy that bit between Manchester and the Lake District. And actually that does have significant implications as we feel a little bit nervous about being eclipsed by the evolution of Devo Meng. We'll come back to that later. We're a little bit famous for some things, Eccles cakes, hot pot, Wallace and Gromit, and the comedy genius of Eric Morecambe, but we're also a little bit famous for something else. The life expectancy of an adult in Lancashire is 18 months less than the average for the rest of the country, and that's not fair, and that's not right. And there's reasons for that. The towns of southern Lancashire used to produce 85% of the world's cotton not that many years ago, and they don't now, but they've left a legacy of deprivation and a chronic disease burden. And as we go north and we get into the beautiful hills of South Cumbria, the rurality gives access and recruitment challenges, which means those patients there are at risk of not getting the services they deserve. So we're coming together as 4 organisations forming one flexible platform with one governance structure. A governance structure, a board that will have patient and public representation and health and wellbeing board representation on it. And a flexible platform because for some of our services we may combine as 2 of the trusts or 3 of the trusts or all 4 for provision of service. And we've already done this for our major trauma services, some of our renal services and our networking for those, and our acute coronary pathways. But actually there's a lot more we need to go at. And we're developing services that will be professionally networked and professionally driven, standardised, 7 days a week, and underpinned, most essentially, by a digital platform, the Lancashire Hospitals Record. So that if a patient presents with an ischemic event or a stroke to Faluku's trust, any time of the day, and needs clot retrieval, well, that patient's films, details, and so on will be sent electronically to the relevant specialists throughout Lancashire, and the decisions will have been made before the patient even walks through the door or is carried through the door on the trolley through to Karen's hospital where the procedure may be taken forward. And that's the important thing. That's one of our key USPs for going forward. It will be better for patients as we standardise and we improve access, we improve outcomes. It will be better for the taxpayer as we lead to better and more rational use of our 1.5 billion shared resource and funds and our 26,000 staff that we employ across 14 inpatient sites. It will be better for commissioners as we develop prime vendor and prime contractor status that operates across the entire county. It'll be better for the professionals who will network. And it'll be better for the organisations in terms of recruitment, and particularly when we come to those very challenging things, and we're all currently fishing through the same pond to try and recruit interventional radiologists and so forth. We'll also be able to plug and play. In other words, we will fit with the vanguards that's already in place in terms of the MCP and Blackpool and the vanguard at Morecambe Bay. You give us this vanguard status and we will show you our passion, commitment, our plans and our ambition. You give us this vanguard and we will deliver you the remote access clinical advice solution. You give us this vanguard and we will give back to the NHS that learning, because if we can deliver this in such a challenged economy as ours, the whole NHS will stand to benefit. I think you could deliver it anywhere. Now, I've talked about the why and the what, and I'm going to hand over to Gary to talk you through the how it's going to happen.
Okay, so hopefully, is this working? Can you all hear me? Good afternoon. Hopefully it will happen through us becoming a vanguard for the acute care with the help of your votes this afternoon. We want to come together through a governance procedure that helps us, as already been said, to put the needs of patients and staff ahead of our organisational needs. And I think, as has already been said this afternoon, that is easier said than done, but we think that we can do it. And I think we can do it because we've got some good experience of Vanguard so far, and we know that if we can get that, it will help us in terms of some of the access to national support, access to expertise, and in particular, I think by putting ourselves in the spotlight, because as has been said, it's not easy, and I think we've already seen from the two vanguards that we've already got that there is an increase there in terms of pace and ambition from putting yourself into that spotlight. In terms of what we hopefully can give to the vanguard, if we are successful in that regard, then I think it's already been said. I don't know what the cricket reference is for a hat-trick. If anyone does know, tell me now, and I will shout it out. But if we can get that hat-trick, I think there'll be some real fantastic learning there that could be spread out across the country. I think in terms of what we can give a leadership community that's relatively newish in post, and you can see, obviously, you've got 4 organisations represented today. But back in Lancashire, through the Healthier Lancashire programme that we've got, whether it's CCGs, whether it's councils, whether it's voluntary sector and other people, there's a great deal of commitment to make this happen and to make a success of it. And then I think finally, just to emphasise again that point that Damien's made, we've got a very large, very varied geography. We've got posh seaside towns, we've got not so posh seaside towns. We've got market towns, we've got inner city, we've got very stable populations in very rural areas often. We've got very transient populations in areas like Blackpool, where around about 15,000 families move in and out every year. And I'm not including in that stag doos and hen doos because they don't tend to stay more than a night unless they've behaved badly. So I'm hoping that with that in mind, you will think that we are a very good proposition. We will do it anyway. We started before today. We've been doing it for a year or so now. And hopefully with your help, we can do it as part of a National Vanguard programme. Thank you.
Thank you very much. Questions for Lancashire?
Hi.
Lady here.
Sam in the corner underneath the screen.
Sam.
You rightly said you've got 2 vanguards, and I don't know what a third one is from a cricket perspective either. So haven't you got enough to do?
No, we're always looking for something else to challenge us. I think that we've got a really unique proposition here. We're already working as part of a whole region system called Healthier Lancashire, and that was built on the premise of a social movement. So actually, long before we came together to present this Vanguard bid, we've got a whole health economy working with patients, designing what we think the health system should look like in Lancashire. So we've had dozens and dozens and dozens of events with patients, with patient groups, with patient representatives, with the whole health economy, with specialist commissioning, with CCGs, etc., a whole raft of people to look at what we need to do. So actually what we're going to do is we're going to build on what we already know that patients and our population want. So what we think that this particular Vanguard will do will bring together all of the work that's going on elsewhere throughout this region, and we think that's quite a unique proposition.
Thank you, the lady here.
Sue Denmark, and I'm from the Coalition for Collaborative Care. I wanted to say that I agree very much with the single record, and I think it's a fantastic idea. It's a bit of something we've all been trying to achieve for a long time. But I wanted to ask you, how much will patients have access to this record? How will they be able to check the accuracy of the record? How will they be able to look at what information has already been collected?
So, as alluded to already, we already have Vanguard, Better Care Together in the Morecambe Bay area, which is all about integration across the piece with local authority, CCGs, the Single Accountable System organisation. And as part of that, we have a significant IT strategy that's underpinning that, and that's where the learning from that will be transferred into this Vanguard. So to answer that question about have we got enough to do, actually we feel that the acute sector is a missing piece in the 2 Vanguards that we have in the area. And building on the learning from the Morecambe Bay Vanguard will help us then underpin the IT strategy for this to enable patient access.
Thank you. Another question from David.
At the beginning of the day, Sam spoke about the importance of replication, that it's great that we can do all of these things in our own localities. So how do we know that Lancashire can take something that you're doing and have capability of that being replicated to other parts of the country? Oh, they obviously like the question.
Let's hope they're cheering at the end of the answer. Well, I think there's a couple of key reasons why. I think one is that the sheer variation in the people that we serve. If we do a good job of this, then I think there'll be an awful lot of lessons that can be taken across the country. I don't think we can claim to have some of the history of some areas actually across the country of joint working so far. So I think in this, I think for us as an area, there'll be a relative element of newness to this. But if we can make it work across those very varied populations with some quite extreme areas of affluence and deprivation, then I think we can roll that out. Second reason, I think, and as you've noticed, that these are certain messages we're trying to get across to you that we'll keep coming back to, is that with a couple of vanguards we've already got, we're already working with the national team, and we're learning, and hopefully learning together on how a good idea, actually making it replicable is actually quite difficult, and yet at the same time kind of quite straightforward if it's a good idea. So we've already got some of that experience, so I'm hoping that those two things combined will help us if we are lucky enough to go forward.
Thank you. Question over here.
Steve Sharp, you've talked about patient involvement a little bit, not very much. Could you give an example of how you've involved the patients?
I'll pick that question up. So one of the things we're doing is through social movement and really getting our local communities to drive the agenda in terms of how they want services to be delivered for themselves. How can we configure services so it makes best sense for them? An approach we've already taken is around travelling miles. So how many miles do you have to travel to get the service that you need? Does that make sense? And how can we make that much more efficient for you as a patient? But also, how does that fit in with the needs and the efficiency in the hospitals? And so we're going to build on that using all the different formats that everybody's already talked about, feedback, but also sessions like this, one-to-ones with some patient groups, patient representatives. We have Health Watch in all our organisations to help us do that. So fundamentally our approach is around social movement.
Thank you very much. That's the Lancashire Group of Hospitals.
Thank you.
Thank you.